Welcome to the Skin Clinic. My name is Rita, and I will be your doctor today. Okay? So, I checked your file before you came in, and you said you were suffering from gauntness, from a lot of eye bags, and some acne here and there. You also said that you had dry skin and a little bit of oiliness in different areas. And you wanted to figure out the best treatment course and plan for your skin type. Alright, so the first thing I am going to do is I'm just going to examine your skin and take a look, okay? And then I will let you know what I think we should do, okay? I am going to start looking at your face in quarters. First, I'm going to do a simple hand inspection, and then I'm going to look over your skin with a light, alright? So first, let me put some gloves on. I don't want to irritate your skin at all. Alright, now that I have my gloves on, let us begin with your examination, okay? Good. So if you could just look slightly up for me. Good. And I'm just going to start with looking at your forehead here and looking at the skin on your forehead and your hair. And do you always wear your hair in bangs covering your forehead specifically? Okay. So what I am seeing here is on your forehead, it seems that like directly underneath your bangs, you do have like a lot of little acne bumps under the skin, and when your hair touches your skin, you do produce a bit of oil, okay? So that is something of note and something you should think about, maybe switching your style up every once in a while so that there is even oil distribution across your face. And as I am looking here, for the most part, that's all I'm seeing with your forehead. It is a little bit oily, but that is all I notice that sticks out to me, okay? Good. So now I am just gonna move to your eyebrows here. And your eyebrows are thin. Do you pluck them often? Okay. So there isn't much hair protecting the area of skin under the eyebrows. So I am just going to look and make sure that you don't have any sunspots or anything that could be dangerous. And that looks pretty good. And while your eyes are closed here, I'm just going to take a look at your eyelids. And when I touch them, they are a bit oily to the touch, which is nice. We want our eyelids to have a lot of moisture because this is the area that's opening and closing often. And we don't want dry skin in an area that does move quite a bit. Good. Your eyelids are looking good. And now I'm going to look at your eyelashes here. And your eyelashes, they're nice and they're thick and they are dense. Good. They are pretty long. They protect you well from the sun, I'm assuming here. I'm not seeing any acne around this eye area. I do see the eye bags that you were talking about. Yes, are quite noticeable. And in the middle here, lots of people do tend to get like little acne here in the middle sometimes, and we do recommend to not pop it. I know that sometimes you really want to pop it, but this is what we call the triangle of death here, and it gets very dangerous once a pore gets clogged in this area. But luckily, you have no acne, although you do what we have called eye boogers in your tear ducts. Let me just wipe that out for you. Good, okay. Looking very, very nice here. Not much to worry about from this area. Alright, now tilt your head up slightly for me, please. Great. And now with my hand, I'm just going to look at your cheeks here and feel the area around your nose and your cheeks. And take a good look here. And so I do see some more little acne spots here and there, but they do seem to be underneath the skin. They aren't poking out much. And it's definitely something that you could hide with makeup. But that grayness you were talking about, I am seeing it quite a bit, especially underneath your eyelids and kind of on the sides of your cheeks here. And I can see what you mean when you said you look a bit gaunt. And has the grayness under your eyelids bothered you for a long time? Okay. Looking here at your face, when I look at your lips look nice, they look moisturized, I don't see any flaking skin or chappedness. When I rub on your skin bounces back, it has a bit of elasticity, which is good. If I push here, they bounce back as well, which is good. And if I rub underneath the chin here, good. So for the most part, it looks like you take pretty good care of your skin, okay? So now we're going to do a more detailed exam, and I'm going to do that with my exam light, okay? And with the exam light, I'm going to look for spots and lumps and bumps, things that can be indicative of cancer. And I know cancer is a very scary word, but you know, you can get cancer from things like the sun. Okay, and we just want to see if you have a bump, and if you do have a bump, we want to mark it and watch it over time. Make sure it doesn't grow. I'm also going to be looking on your skin for anything that has weird shapes and sizes, and we'll be taking a biopsy of those if I do find anything that looks a bit strange in size, okay? What I'm looking for is things that have even margins, for it to be even in color, and for it not to look weird, like a squiggly line almost, okay? Great, so let's take a start. And so now with this pen light, I am just going to come here and start with your forehead again. And we are just looking for any of the bumps, if they have an abnormal shape, if they look weird, and if they look unsafe, okay? And as I start at the very top of your forehead, close to your hairline, I think that everything does look good and it all looks fine here. And as I move slightly down a bit, just maybe less than an inch, I do see a little mark, but that looks fine. Even margins, perfect in color. And over here, another one, even margins, perfect in color. So these aren't moles, but they don't look like sunspots either. Some people call them beauty marks, and that looks fine. So you have nothing to worry about that. And now looking at the center of your forehead here, and everything is looking pretty good. You don't really have much to worry about there. Wonderful, wonderful. Alright, now I'm going to start moving a bit lower, and we're going to look at your eye area again. And your eye area entails your eyebrows, your eyelids, your eyelashes, okay? And a little bit underneath your eyes. So we are just going to take a quick look here And that all looks wonderful. And then we're gonna take a quick look here, and that looks good as well. And perfect. Okay, now tilt your head up for me, please. Good. And now I'm just going to take a look at your mouth here, and that looks pretty good. Wonderful. And your cheeks, and that looks good. And your other cheek. Great. And we're just gonna look at your bridge cheek, good, and your neck, good, and your collarbone, great. And now I'm just gonna look at your shoulders, wonderful, and this arm here, good. Alrighty, so you look pretty good. I am going to give you some cleansers and things for the oiliness of your skin. Really, you only have oiliness here on your forehead and your T-zone. If you give your hair a bit of air here, it should reduce the oiliness on your forehead, and it's common to have oiliness around here, so you don't have anything to worry about there. As far as the blackness underneath your eyes, do you sleep very late at night? Yeah, so try going to bed earlier. And do you drink water every day? Like, how much fluids do you get? Okay, so I would recommend trying to sleep a bit earlier and get more rest and see if that changes your eye bags, okay? If not, it could just be genetic. You know, some people's eyes underneath their eyes are fuller than others. And if it's not a genetic issue and it is a skin issue, we'll come back and we'll revisit it in more detail, okay? Alrighty, thank you so much for coming into the clinic today. I hope I was able to help you with all of your needs, and I'll start to write you those prescriptions, and I'll see you next time. Bye bye.